Hello, I'm Cristiana Sieiro Santos. I'm a rheumatologist and a clinical researcher at the University of Manchester in the UK. And we are here in Cambridge for the Scleroderma meeting. I'm joined by Professor Massimo Pinzani, who is a emeritus professor at UCL College in London. And we were lucky enough to hear your talk yesterday. Thank you so much for, first of all, to agreeing to do the interview. You had a great talk on organ fibrosis and also the search for antifibrotic treatments. So to start off our interview, I would like to ask you, how crucial do you think it is to identify biomarkers that could not only help us stratify patients, but also to analyze whether they could help us identify a treatment response?
Thank you, Cristiana. The biomarkers are crucial in all the management of a fibrotic disease. First of all, we can talk about diagnostic biomarker that basically they replace a biopsy or an invasive test. That will be necessary up to some point, but a non-invasive biomarker or a blood test instead of a biopsy will basically able to tell, we hope, with the refining this area, at which stage is the fibrotic disease. So it could be very early stage, intermediate stage, or advanced stage. Although in general, a very advanced stage manifests already with symptoms and clinical manifestations. A second type of biomarker will be something we can define as a prognostic biomarker. So we'll give an idea on the long-term evolution of the disease and will help stratifying patients that need to be treated now or tomorrow instead waiting because the disease, it doesn't have a prognostic rapidity. And the third type of biomarker, once we have drugs, will be a biomarker that helps to understand if the drug that we are using, has engaged with the target.
Mm-hmm.
So, when we make sure that the drug has reached the target, and then will help to also help in understanding if the treatment is effective.
Yes, thank you so much. And I think the question on everybody's mind, because your talk was mostly on liver fibrosis. What are your thoughts about the future? Do you envision developing a pan antifibrotic drug that not only is useful for liver fibrosis, but because we are at a systemic sclerosis meeting, it could be also useful for ILD and for heart fibrosis?
Yeah, the holy grail is actually to find, if we can find a pan antifibrotic to be used in the majority of fibrotic disease, would be a great development. Although, even having such a very useful weapon, the way that we aim the weapon, against the enemy has to be very carefully considered, because there will be situation where it is not convenient to treat fibrosis in a very aggressive way. For example, all the disease that we know the cause of the damage and leading to fibrosis, the best way will be basically to stop, for example, to eliminate the virus, eliminate
The
toxic damage or autoimmune damage, and so. So my prediction, my vision is that there will be clearly some strong pan antifibrotic. I'll put in the first category. Then there will be a second category of drugs that had already been used as antihypertensive or anti-inflammatory, that we discover they have actually a power to be antifibrotic. And this would be probably the easiest way to introduce them, because we know already the side effect, we know already the dose. What would we need? We need somebody to pay for a clinical trial.
Absolutely.
Because otherwise we stay always with this hypothesis. And the last, it will be a very refined type of antifibrotic drug, which is tailored on a specific disease, on a specific tissue. So this means it's not pan an antifibrotic is an antifibrotic for a specific.
The specific disease. Thank you so much. That's what. Thank you so much for agreeing to do the interview.